Well, we're joined now in the studio by the Health Secretary, Matthew Hancock. Thank you very much for being with us.
Good morning.
Difficult few days for all of us, I'm sure. Before we get on to the rest of the interview, I just want to play you a clip of the Prime Minister. This is from Wednesday.
We don't want to, as I say, to ban Christmas, to cancel it, and I think that would be frankly inhuman and against the instincts of many people in this country.
Why has the Prime Minister now imposed a policy that just 4 days ago he said would be inhuman?
Well, we don't want to do any of this, but it's necessary. I mean, this has been an awful end to what has been an incredibly difficult year. And on Friday, when we were presented with that new scientific evidence about the new variant, it was our duty to act. And you know, from being presented on Friday afternoon with just the strength of how easy this new variant finds it to transmit from one human to another, we acted very quickly and decisively, and with the announcements that the Prime Minister set out yesterday. And you know, I just think everybody watching will feel this sense that we both feel of disappointment, and that it's just so difficult ahead of Christmas, which everybody was really looking forward to after all of the sacrifices that have been made. But unfortunately, this virus, the new strain, was out of control. We've got to get it under control. And the way that we can do that, the only way you can do that, is by restricting social contact. And essentially, especially in Tier 4 areas, everybody needs to behave as if they might well have the virus. And that is the way that we can get it under control and keep people safe.
I think people understand the reasons behind the restrictions. I guess the question perhaps some have is the way that it's been done, so close to Christmas. And you're saying, of course, that you only found out the full information about the new strain on Friday. But at the same time, so the Chief Medical Officer said yesterday, you know, there's no current evidence to suggest the new strain causes a higher mortality rate or that it affects vaccines and treatment. So all that's changed is that it transmits more easily.
Yes.
And I understand that you didn't know about the new strain, but back in November, on the 24th of November, when you announced the Christmas relaxation, it was entirely predictable that the virus might be spreading more quickly than you thought at the time. So why did you make that promise all the way back then and get everyone's hopes up?
No, in November, thankfully, the numbers of cases was coming down.
Yeah, but I understand they were coming down in November, but you could have predicted that they might be going back up again in 4 weeks' time. It's an extremely unpredictable virus.
Well, as you say, it's very unpredictable. And
so why did you make that promise?
Well, it's very unpredictable because I understand how important Christmas is to people who've been looking forward to it all year. And you know, thankfully, in many parts of the country, it is going to be possible to have a restricted, very careful Christmas break, essentially on Christmas Day itself. But the whole challenge of dealing with this pandemic has been that, being unprecedented, we've had to learn about the virus all the way through. And then we've got this new variant, which the scientists are still learning about. I mean, you know, even today, they're doing more research on it to understand more. And what matters is that, you know, as a society, we need to stop this new variant from spreading. And we can only do that not just with action by government. And sometimes, you know, these debates sound like it's what is the government going to do? Of course, we've got an important role, and that's why we acted so fast yesterday. But it's what is everybody going to do? Because it's only if we all take personal responsibility to act in a way that doesn't spread the virus. That's the only way that we can get this new strain under control.
I just want to come back to the point about why you announced the Christmas relaxation a month before it was going to happen. Because you say that it was because you care about Christmas, you know how important it is, but surely it's the hope that's worse, isn't it? You know, people have been preparing, they bought the turkeys, they've got through the last few weeks thinking at least I'm going to be able to see my nan on Christmas Day, and now at the last minute that's been ripped away. I understand the new variant is here, but it was entirely predictable that the situation would have changed in 4 weeks' time. So why did you make the promise when you must have known there was a chance you might not be able to deliver it?
Well, because we've got to balance these different things that people, all of us want,
So
right?
why make the promise, though?
Well, we made a commitment, not knowing, of course we didn't know, in the same way that you didn't know, Sophie, that there was going to be a new variant that spreads so much faster, which we found out about. We found out about the existence of it last weekend, and then we found out about this property it has, the fact it spreads so much easier. We found out about that on Friday. So I understand how people are feeling, and I feel it. You know, I had to call my mum last night and say, you know, we're not going to see each other over Christmas, and because of this new strain, it is a really very, very serious situation that we all find ourselves in. And we've got to come through it together. But as Dr. Nagpal was saying, the good news is that there's light at the end of the tunnel. The good news is that the vaccine rollout is going well, and it's accelerating, and we're vaccinating more and more people all of the time. So we can see the way through this, but it is going to be a difficult few months between now and then.
You've been talking about how the new strain spreads a lot more easily. Is there a concern that, you know, the current measures that we're taking to protect ourselves, 2 metres social distancing, face masks, are not going to be enough?
Well, what matters is that the new rules, restrictions that we've brought into place this morning, what really matters is that people not only follow them, but everybody in a Tier 4 area acts as if you have the virus to stop spreading it to other people. So the advice on, for instance, the 2 metre rule is that it is that is we should continue with the 2 metre rule, but we just know that this new variant, you can catch it more easily from a smaller amount of the virus being present.
So it would be less effective. Face masks, social distancing, effectively less effective.
All of the different measures that we have in place, we need more of them to control the spread of the new variant than we did to control the spread of the old variant. That's the fundamental problem. And we know that because we know that in November, in the areas where this new variant started, in Kent, the cases carried on rising, whereas in the rest of the country, the November lockdown worked very effectively. And, you know, in parts of northern England, the rates have come down really sharply.
Yesterday, the Prime Minister said the new variant is up to 70% more transmissible than the old variant. My colleague Sam Coates has seen minutes from the SAGE meeting on Thursday, though, the government scientific advisors, that says the extent of any increase in transmissibility is not yet known. So
that's right.
What's the 70% figure based on then?
So that was new analysis that was presented on Friday. And this just shows how fast the scientists are working, and they're doing incredible work. You know, one of the reasons we know about this strain is because of the incredible scientific work and the genomics in particular. So because many other countries around the world may have this strain or something similar to it, but there's only a couple of other places where we know it exists, where they also have the sort of genomics. Well, for instance, there's been a case in Australia and in some parts of continental Europe.
Right.
But it doesn't take away from the actions that we all need to follow here in order to get this under control.
If it is 70% more transmissible, that's pretty bleak. That's bad.
Well, it's an enormous challenge until we can get the vaccine rolled out to protect people. And that's this is what we face over the next couple of months, yes.
You also said yesterday at the press conference that there's no current evidence to suggest the new strain causes a higher mortality rate. My question, though, is, you know, we've only just found out about this new strain around a week ago. You only got the evidence on transmissibility on Friday. We can't possibly know yet, can we, if it does cause higher mortality?
Well, they have looked into this because there's over 1,000 of these cases that have been identified over that period of time in the last just over a week since the new variant was identified and brought to ministers' attention. And so they can then look at the impact of the disease on those people.
But there's a lag, isn't there, between catching the disease and becoming ill and sadly dying?
But because of the high-quality surveillance that we have, they've been able to go back and find old cases and then track what happened to those people. So we have a degree of confidence in that outcome. And I think you have Susan Hopkins on your programme later.
We'll be asking her.
Well, she's the lead expert on this, and she'll be able to explain exactly why we have confidence in that outcome.
Could it be milder?
There's no evidence of that either, sadly.
OK, that's disappointing, but definitely worth asking the question.
Yes.
Now, there will be a review of these Tier 4 restrictions on the 30th of December. You were saying, though, that Tier 3 didn't slow the spread of this new variant in Kent. So in reality, people in Tier 4 restrictions, they're not going to be coming out of Tier 4 anytime soon, are they?
Well, we've really got to get this under control. And the cases in the Tier 4 areas, as you've seen from the graphs that have been presented, have absolutely rocketed in the last few days, last 2 weeks or so. And so we've got a long way to go to sort this. Essentially, we've got to get that vaccine rolled out to keep people safe. To
prepare ourselves, I mean, is it likely that if you're in a Tier 4 area now, you're going to be in a Tier 4 area until that vaccine is rolled out?
Well, I think that given how much faster this new variant spreads, it is going to be very difficult to keep it under control until we have the vaccine rolled out.
And other parts of the country are likely to go into Tier 4 too?
Well, one of the reasons that we brought in very strict travel restrictions, saying you shouldn't leave a Tier 4 area, you should stay at home, is to try to prevent this from spreading across the rest of the country and indeed to other parts of the world that don't already have it. And we're trying to protect the rest of the country because obviously under the old variant, the Tier 3 restrictions were working, and you can see that in several parts of England. So we want to try to restrict the spread of this, as well as, of course, stopping it from spreading in the areas where it's already rife.
You're talking about the importance of not travelling. Many of us will have seen those images of people leaving London. I think we might be able to show some as well. I mean, look at the packed stations there.
Yeah.
What would you say to people who did travel?
Well, this was clearly totally irresponsible behaviour. The chief medical officer was absolutely clear that people should unpack their bags if they had them packed. I think that it's relatively small numbers, and the vast majority of people throughout this whole pandemic have followed the rules, been responsible and played their part, and I want to thank everybody for doing that. It is more important than ever that people are responsible, not only stick to the rules, but even within the rules, restrict social contact as much as is possible, because this is deadly serious. And you've heard from the British Medical Association just now the impact on hospitals, especially in East London and in southern parts of Essex and in northern Kent. And we're also seeing the impact, sadly, in the figures, the number of people who are dying each day. This is a deadly disease. We've got to keep it under control, and it's just been made more difficult by this new variant.
If infections continue to rise, will you consider closing schools?
Well, schools are closed for the next few weeks, and the Education Secretary has set out...
But they're due to reopen?
Well, that's a few weeks hence. The Education Secretary has set out how we're planning to reopen schools using testing to reduce the spread. And so there's an awful lot of work going on, and I'm very grateful for all of the teachers and admin staff at schools who are working over Christmas to get those proposals in place. But
just to be clear, if infections continue to rise, could you consider asking schools to move to online learning?
Well, the Education Secretary set out the plans for schools in January, and because of testing, and because we know the tests work on this new variant, we're able to, we've got plans to keep schools open that are essentially in a way that can stop them from transmitting the virus by using very extensive testing in schools.
Just quickly, would you consider recalling Parliament to vote on the rules?
Well, the rules are already in place.
It's not quite the question, though. Retrospective vote?
Well, there will be a vote in Parliament on these rules, yes, in January. But obviously, having taken the decision on Saturday lunchtime and brought it into force in the early hours of this morning, we didn't have time to recall Parliament from the point of decision at 2 o'clock yesterday afternoon, when Cabinet concluded in support of these measures before implementing in the early hours of this morning. And therefore there will be a vote after the fact when Parliament comes back in January.
We touched on vaccines a bit earlier in the interview, but it does feel like it's worth asking again because it's such something that all of us are clinging on to, if you like. There have been some concerns about the speed of the vaccine rollout, though. It was said that we'll have to double the rate at which we're rolling the Pfizer vaccine out if you want to vaccinate all vulnerable people and key workers by Easter. Are things going to ramp up, and how far away are we from approving the Oxford vaccine?
Well, I feel I'm able to smile for the first time in several days. The numbers are accelerating and rising fast, the numbers that we're vaccinating.
Can you give us some new numbers then to give us a bit
Well, as of 8 o'clock yesterday morning, 350,000 people have been vaccinated. We plan by the end of the weekend to have something around the 500,000 mark. I'm not going to that's not a target, that's an estimate. We're vaccinating more and more people each day. We've now got over 400 different sites that are vaccinating, whereas at the start of last week we only had 100, so that's a multiple of 4. So you can see that there is a significant acceleration in the plans. Some people have seen the total number that have been vaccinated and extrapolated that in a straight line. That's the wrong thing to do, because all the time, every day, we're opening more and more vaccination centres. We're bringing more and more of the GP-led centres on stream.
And how far away is the Oxford vaccine from approval?
Well, that's a matter for the MHRA, the regulator.
Could it happen before Christmas or after Christmas? What's the...
It's very tempting, but I'm just not going to speculate, because I respect their independence, and that includes their independence to choose the timing of any announcement.
I need to ask you about Brexit, but just very quickly, if you knew your neighbours, for example, were breaking the rules at Christmas, would you call the police? Well,
I just think it's so important that every single person follows these rules.
So would you call the police then?
Well, I think everybody should follow the rules. And I don't think we should get. It does, but it needs saying, Sophie, because it's so important in this pandemic.
OK. Running out of time, and I do need to talk about Brexit, of course. Just 11 days until the end of the transition period. What state are the talks in? How confident are you that there'll be a deal?
Well, I think the talks are continuing. I understand that the EU have put in a deadline of having them concluded by Christmas. We want these talks to reach a positive conclusion. Of course, I want a deal. I think everybody wants a deal. Unfortunately, the EU have put in some unreasonable demands. And I just, obviously I've been mostly concentrating on the pandemic, but I have been looking at the detail of some of the requests from the EU. They're unreasonable. They do not respect the result of the referendum.
What in particular is unreasonable?
Well, over the sovereignty of our rules around the so-called level playing field. Actually, this is rules around how government introduces subsidies, and then overfishing. So I'm sure that a deal can be done, but obviously it needs movement on the EU side. And I'm an incredibly pragmatic politician, and I want to see a deal. But I also think that the EU demands are unreasonable, and they're not demands that can be accepted. So we do need to see that movement from the EU side. And I very much hope that they make the steps that are necessary so that we can conclude a deal, and then we can all look forward, and we've got a huge amount to get through as a continent, because there are very significant problems with this virus on the continent as well. Of course, we're seeing cases rise in many continental countries. So let's just. They need to make the move, they need to remove some of the unreasonable requests, and then we can all move forward and concentrate on dealing with the things that are right in front of us and need urgent action.
The EU Parliament set a deadline of tonight. Do you think there's any chance a deal will be done this weekend?
Well, I don't know, but I think we should keep talking and we should come to a deal. And I think that it's just so important that the EU side makes the changes that are needed to be able to get a deal. And otherwise, we're ready for an Australian-type outcome if that's what's necessary.
No deal. Australian-type outcome.
Well, we've already got the withdrawal agreement, and that deals with a whole load of the problem. No further. We're ready for that. That's not an outcome I wish to see, but we're absolutely ready for it. But I hope that we get the movement from the EU that we need.
OK, Matt Hancock, we're out of time. Thank you very much for being on the programme this morning.
Thank you.